Well, we know when it comes time to choose a healthcare option, it can be conflicting, confusing, and sometimes even contradictory. But that's why we're here at Plum Health with Dr. Paul Thomas, who's going to break it down for us and help us, especially as we come closer to open enrollment season. How are you today?
I'm doing great. Thanks so much for asking.
So today, I know Plum Health has really made itself a household name with its affordable options and its incredible reputation for the ways that you guys have helped Mid-Michigan and really Michigan families overall.
Thank you.
I want you to talk to us a little bit more about how Plum Health got started and what you guys are aiming to help the community with.
Yeah, Plum Health, we believe that healthcare should be affordable and accessible for everyone. And we really focus on direct patient care, so direct primary care to our patients. They sign up with us for a monthly membership and they can come see us anytime they need to. They can call us, text us, email us, and we guarantee a same day or next day appointment for them. We started in 2016 in Detroit, and this idea has grown over time where more and more people, families, companies, and school districts have wanted to embrace this direct primary care idea, and now we're serving multiple thousands of people across 5 different locations in Michigan.
And with the different locations all across the state that you've expanded to, what are some of the things that you hear on the other side of the phone or on the other side of the email that families are having trouble with when it comes to healthcare options?
Well, I answer the phone and the person on the other line would say, I'm talking to the doctor right now, right? And so that's a game changer, right? When you can call the office and speak directly with your physician or directly with your nurse practitioner or physician assistant, and you don't get that runaround from the other offices. And then when you call and you request an appointment, you might hear me say, how does 3 o'clock, how's 4 o'clock for you? Versus how's, November 15th or December 20th, or, most people are used to 3 to 4 week wait times to get an appointment with their primary care doctor. And then they're forced to go to the urgent care where they don't know the person there in their hour of deepest need, right? And so we flip that on its head and we deliver care directly to our patients on demand, same day, next day.
I love the fact that you said, we'll pick up the phone and say, wait a minute, I'm talking to the doctor. And like you said, when you are in the worst moment, you are your child, you're in that deepest, darkest moment, and you're not sure exactly what to choose. That's when you're starting to look over your health insurance and say, wait a minute, this is what I signed up for. The fact that we can meet you that same day and figure out what are the next steps to do, I think really shows us that, hey, there's a light at the end of this tunnel too.
Indeed. For me, I know a lot of young families in the community call us around 2 o'clock and say, my child's been sent home from school with a sore throat and we're concerned about strep, so they come in at 3 or 3:30 or 4 o'clock and we're able to do a rapid strep test or make a diagnosis by looking to their throat. And then we have an in-clinic pharmacy and we can give you amoxicillin from the clinic, right? And so we mix it up and show you how to use it. And so you don't have to go to the big box pharmacy and wait for an hour and get charged $20. We can give you amoxicillin for about $1.25.
How does Plum Health work collaboratively with other employer groups?
Yeah, so we touched on individuals. People can sign up with us for $75 a month to be a part of our service, but we also service large employer groups. So if Lansing Public Schools and other public schools in Mid-Michigan use our service, they send their employees and their families to us, and they get the same excellent care that we serve to our individual customers.
Well, Dr. Thomas, a lot of times we may already have insurance, maybe through our spouse, through our employer. Are we able to add Plum Health in addition to what we already have?
Yes, you can. So we have a individual, couple, and family membership rate, and you can join as an individual or with your spouse and your children, and you can access us at any time that you need us. A lot of people use our service because we have that convenience effect. You may have great insurance, but they're not going to guarantee you a same day or next day appointment with your insurance. That's health insurance, what you have with your card in your pocket. We are health care. We actually care for our patients. We have the empathy, we have the time, we have the capacity to see them same day or next day and help them with their acute concerns.
How can we continue that conversation with you?
Yeah, so plumhealthdpc.com is our website. You can enter your information, sign up on our website, and we'll reach out to you within a few hours and get you enrolled in our service and answer any additional questions that you have.
That is awesome. And of course, we have that information at the bottom of your screen. But thank you, Dr. Thomas, for really breaking that down here for us.
Thanks for having me on. It's a pleasure to talk to your audience.